The ophthalmic nerve is the first branch of the trigeminal nerve. It exits the cranium through the superior orbital foramen. Several cutaneous branches spread over the anterior superior face. A regional nerve block of the ophthalmic nerve provides anesthesia to the ipsilateral forehead and frontal sinuses. To perform the block, position the patient supine on a stretcher. Palpate the superior orbital rim and identify the subtle supraorbital notch. This notch is in direct line with the pupil when the patient is staring straight ahead. Prepare the skin around the notch with a cleansing agent such as chlorhexidine. Use care not to introduce the agent into the eye. Using a 3.5 centimeter 25 gauge needle, raise a wheel of anesthetic over the supraorbital notch. Then attempt to verify the location of the nerve by eliciting paresthesia over the forehead. Once paresthesia has been elicited, withdraw the needle 1 millimeter, aspirate to exclude intravascular placement, and slowly inject 3 milliliters of anesthetic. If paresthesia cannot be elicited, or the nerve block is unsuccessful, place a line of anesthetic subcutaneously along the orbital rim from the lateral to the medial aspect to ensure a block of all the branches of the ophthalmic nerve. If the anesthetic is placed on the forehead proper, this block may not produce complete anesthesia of the skin of the upper eyelid if the sensory branches to the eyelid are given off before the supraorbital nerve transverses the forehead. The infraorbital nerve is the second branch of the trigeminal nerve. It exits the skull at the infraorbital foramen, which is located on the inferior border of the infraorbital ridge. A regional block of this nerve provides anesthesia to the ipsilateral midface, lower eyelid, skin of the nose, and upper lip. Either an extraoral or intraoral approach may be used. In this video, we demonstrate the intraoral approach, which may provide a longer duration of anesthesia. The use of epinephrine should be avoided with this technique to avoid vasoconstriction of the facial artery. To perform the block, position the patient either supine in a stretcher or sitting in a dental chair with the occiput firmly supported and the body of the mandible parallel to the floor. Identify the infraorbital foramen by palpating along the inferior border of the infraorbital ridge. The foramen is in line with the pupil when the patient is staring straight ahead. Begin by applying a topical anesthetic to the superior buccal mucosa. First, dry the area with gauze to prevent saliva from washing away the anesthetic. Then, apply a topical anesthetic, such as benzocaine, to this region. Continue to palpate the foramen and use a piece of gauze to retract the lip and expose the mucobuccal fold. Insert a 3.5 centimeter 25 gauge needle into the mucosa opposite the second premolar tooth. Direct the needle parallel with the long axis of the tooth until it is palpated near the foramen at a depth of approximately 2.5 centimeters. If the entry is too acute initially, you will encounter the malar eminence before approaching the infraorbital foramen. If the needle is extended too far posteriorly and superiorly, the orbit may be entered. Stop the procedure if you are unsure of the location of the needle or if patient cooperation is unsatisfactory. Aspirate to rule out inadvertent intravascular placement, then inject 2 to 3 milliliters of solution adjacent to but not within the foramen. After injection of the anesthetic, massage the area for 10 to 15 seconds to hasten the onset of anesthesia. If you are not certain of the exact location of the infraorbital foramen, you may obtain anesthesia by performing a field block. Inject 5 milliliters of the anesthetic solution in a fan-like distribution in the upper buccal fold. This technique is not as precise as a discrete nerve block, but usually produces the same effect. The mental nerve arises from the third branch of the trigeminal nerve. It exits the mandible at the mental foramen below the second premolar tooth. A mental nerve block provides anesthesia to the lower lip. Some fibers from the mental nerve cross over to the contralateral side of the face. Therefore, repair of lacerations of the midline of the lips requires blocking the mental nerve on each side of the face. To perform the block, position the patient either supine in a stretcher or sitting in a dental chair with the occiput firmly supported and the body of the mandible parallel to the floor. Identify the mental foramen by palpating the buccal mucosa 1 centimeter inferior and anterior to the second premolar. In general, the foramen will be found just medial to the pupil while the patient is staring straight ahead. First, dry the area with gauze to prevent saliva from washing away the anesthetic. Then, apply a topical anesthetic such as benzocaine to the region. Use a piece of gauze to retract the lip and expose the mucobuccal fold. Insert a 3.5 centimeter, 25 gauge needle into the mucosa and direct it at a 45-degree angle to the mental foramen. Aspirate to exclude intravascular placement and inject 2 milliliters of anesthesia adjacent to the foramen. Massage the area for 10 to 15 seconds after injection to hasten the onset of anesthesia.